An important topic, diabetes and kidney. A common question in the OPD by the patient is diabetic nephropathy reversible? To know the answer, first we have to know why the kidneys are involved in diabetes. Diabetes, because of the higher sugar content in the body or hyperglycemic state, it can affect any organ in the body or any part for that matter. Kidneys are no exception. Kidneys, the filtering structure which is very sensitive, the microcapillary changes, and also in the filtration structure itself, and also in the tubules, basically the filtration unit as a whole, over a long period of time. What is that long period means? Minimum 5 to 10 years. If the sugar is somewhat on the higher side or uncontrolled, we can say, it might have impacted the kidney, which results in diabetic nephropathy or diabetic kidney disease. Leave out the technical terminology, but the difference between these two, DN, diabetic nephropathy, versus DKD, diabetic kidney disease. For this general discussion, we can take these two nomenclature as same, the kidney in diabetes. What are the manifestation? Because of these hyperglycemic changes, the kidney impacted, which result in losing the protein. Ideally, it should not. Ideally, up to 150 milligram per day, the kidney can release or can go out. It gradually start increasing. Why? Because of the hyperglycemic insult and the various damages the microcapillaries encountered in a hyperglycemic milieu. The proteinuria from 150 milligram, it start increasing, out of which the most important component is the albumin. That is why many a times you might have heard albumin is a sensitive marker to pick the diabetic kidney disease or diabetic nephropathy. So now, once this proceeds for a bit longer time, proteinuria along with the load on the kidney, the patient will start having impacts on the kidney function. That is the time where the creatinine start rising. So coming to the question back to the square one, is diabetic nephropathy reversible? The answer is yes. Reversibility per se, not about the technicality in the biopsy report and all. It can be controlled through various measures. Drugs are available. Before going into the drugs are always secondary. The most important one is the hyperglycemic milieu should be controlled. That is basically diabetes control. A HbA1c less than 7 is ideal. A strict diet control along with the diabetes level sugar control will have a major impact. Impact in the sense the progression can be slowed down or stopped. Depends on the stage where the patient is being diagnosed. Let us take the patient is in particular stage. In the beginning stage, stage 2, 3, 4 and 5 are advanced. Let us take till stage 3. In the beginning stage, if sugar is under control, yes, the progression can be halted. Reversibility, clinically we can say, not into the technicality. Second one, blood pressure control, because kidneys as a diabetes, even though diabetes is the sole predominant or the primary impact on the kidney, blood pressure, a high blood pressure will have a next impact or increase the burden on the kidney, thereby progresses the or accelerates the function deterioration. Blood pressure should be under control. Ideal BP of 130 and 80, 130 systolic, 80 diastolic will be good enough to control or halt the progression. The third one, any other particular disease or a parameter which is masquerading or coming along with the diabetes. For example, a drug-induced renal damage should be looked for, have to be treated, or the drug have to be replaced. A common clinical scenario is taking the painkillers, a large amount of painkillers for knee joint pain or whatever the pain it is. It will have an impact or accelerates the progression. Apart from that, smoking, an important accelerator of the diabetic nephropathy or diabetic kidney disease. Alcohol, a high salt intake. These are lifestyle changes which can be controlled if the patient is aware, or if the patient who's Watching this video, probably you might want to halt or stop your progression. These are the simple steps. Once you follow, there will be a huge impact or the progression will be slowed down. These are all the general things. Coming to the specific, is there any drug particularly? Yes, there are many drugs which are available to halt the progression or reduce the speed of progression, depends on the stage. For that we need a theoretical or more of a value discussion, which might not be the scope of this video. At least overall, if I have to tell, there are drugs which blocks RAS inhibitor, which blocks the RAS system, called as RAS inhibitor. SGLT2 inhibitor, it is nothing but a particular channel in the kidney which blocks, the drug blocks that channel, thereby reduces the progression. Aldosterone inhibitors, blockers, and newer drugs are coming up. So with respect to this diabetic nephropathy progression, or it can be halted or not, the progression can be halted. Clinically, reversibility is possible, but theoretically, the ultrastructural changes might not reverse. But for the patient, the answer with respect to particular topic is reversible if appropriate steps are taken, and it need a multiple things have to be taken into consideration, then a final decision have to be made. What is the eGFR of the patient? What is the age? What was the HbA1c in the past? What is the urine ACR level? What is the ultrasound report? Is there any other disease suspicion is there or not? Everything have to be taken as a whole, and the decision have to be made. This is for today. Bye bye. We'll see you in the next video.